Welcome to Life Sutras, where we have empowering conversations with thought leaders that will inspire you to be a healthier and happier version of yourself. We will explore science, the subconscious, as well as the spiritual. Good health equals harmony between many dimensions of mind, body, environment, and the unknown. Hi, I'm Aanchal Bhatia, author of Your Doctor is Not God and How to Be the CEO of Your Health. I believe that health is by choice, not by chance. I am a clinical psychologist by education and an entrepreneur by profession, and a social change agent by passion. I'm a wife and a mother of 2 boys. My husband and I are one formidable team, and that's how we founded Sydenham Clinic, a private health management clinic here in Houston. Welcome and let's explore. Hello and welcome to Life Sutras. My name is Aanchal Bhatia, and today I'm joined by a very special guest, the pioneering and award-winning psychiatrist, Dr. Raymond Cho. Dr. Cho is a professor of psychiatry at the Baylor College of Medicine here at the Texas Medical Center. He is very prominent at research, and he's published more than 50 journals. His resume was, I think, 45 to 50 pages long, and I had a tough time going through it. He's received numerous awards, including the NARSAD Independent Investigator Award. While he was a resident teaching, he got the recognition as a Houston top doctor. Raymond is also best known as the only transcranial magnetic stimulation provider, TMS, in the Houston area to receive federal funding for further research on mechanisms and clinical efficacy of TMS. Dr. Cho previously also worked at the University of Texas Health Science Center here in Houston, and he served as the chief of psychiatry at Harris Health LBJ Hospital, and was the director of integrated clinical neuroscience and treatment as well. He contributes a lot to education by organizing educational programs for patients, families, and mental health professions. But what I also discovered is that he is also a rock star, and he had his own band, and he's in the process of forming a new band more along the lines of jazz, right? Mm-hmm. Well, thank you so much for coming to our show. I'm really honored to have you here.
Well, thanks so much, Aanchal, for the kind invitation, and looking forward to a fun, hopefully fruitful discussion about mental health and related issues.
Yes, and mental health today is more important. I know we're in the middle of a pandemic, but there's also an epidemic of loneliness. And social distancing has just made it worse. And I'm hoping we can get into that a little later. But before we start, I'm very interested and curious to know what made you take up medicine and psychiatry in particular?
Mm-hmm. Yeah, so that history goes way back, and I won't tell you my whole life story, but probably from high school and certainly in undergraduate, I did have notions about how we might use science to help people, help humanity. And the field of medicine is a well-worn path in that respect. I think I married my interest in the mind and brain together with that more sort of humanistic interest and goal. And so I thought about the natural medical subspecialties like psychiatry, neurology, neurosurgery, but then quickly realized through med school electives and rotations that clearly psychiatry was the best fit. One of the things that intrigued me immediately was the very apparatus that we use to perceive the world, understand people, guide our actions and behavior. Most of these psychiatric disorders really hit at the core of those processes that allow us to do those things. And these are really the things that define us as being human, uniquely human, define us as individuals, how we act, think, and behave and feel will distinguish us from another. And those very core processes are unfortunately disturbed in the various disorders. So it intrigued me that what most of us take for granted in being able to lead our daily lives is compromised. And then you see the toll that it takes on people's lives and those around them as being, really devastating sometimes.
Yeah.
So I thought I'd use whatever kind of school smarts and people skills that I had to devote towards that path, and ended up doing a lot of research, as you noted, but also spent many years, the past 2 decades, treating lots of patients with various kinds of mental illness.
Well, depression impacted our lives personally because my husband's father, before I married him, had major depressive disorder. And I mean, just to your point, it impacted everyone. It impacted my husband, who was just 19. He had to come back from Harvard at that point. And it does disable families. And until the time you've not dealt with it, you really don't understand it. So if you can help our listeners just understand depression and anxiety, especially now, a lot of times we don't even recognize it and know how to deal with it. I mean, dealing with it is a separate issue, but can you shed some light on that?
Sure, yeah. I can sympathize and empathize with what you went through and your father-in-law. Depression can be very devastating. And I think, everybody has some conception of what depression is. I think what's often not fully appreciated or understood is that it is an actual medical illness, just as real as, say, diabetes or hypertension or heart disease. Often it's misconstrued as just lacking the willpower or motivation to just snap out of it. People are just expected to often pull themselves up by their bootstraps. But for anybody that's been depressed or been around depression, close family member or friend realizes you can't just snap yourself out of it.
No.
And there's been extensive research, cognitive studies, clinical studies, and in particular, brain imaging, electrophysiology, and genetic studies that make it indisputable that it really has a biological basis. Not to say that external factors can't impact and trigger. So if you have a life stressor, for instance, say a death in the family, and you're vulnerable to depression, that may trigger a depressive episode. If you have financial stressors, if you have physical health issues, and to the point of the context of our current discussion, during this COVID period, there's a lot of things that are happening in the economy and our personal lives that if you haven't had depression before, might trigger an episode. If you've had a history of depression, may be an added stress that may worsen depression or trigger another episode. So there certainly are these external factors, but over and over again, studies show very regular patterns of brain functioning disturbance, either through neuroimaging or electrophysiology, cognitive studies that show cognitive impairments, genetic studies that show genetic basis for depression. So just study after study, evidence after evidence type that shows it really is a medical illness like others. And
we found it here too in Sydenham Clinic. We do a very detailed genomic test, and there is a whole mental health panel there as well. And we see that there is a genomic basis. There are certain genes. Dr. Rice, of course, knows exactly the names of those genes. But epigenetics also plays its part. So I don't think your genes are your destiny. And like you said, there are certain life stressors that can, trigger those genes but at the same time, what are some of the more predictable, ways to identify depression early or to predict who's going to get depressed or not? One is genomics, of course, but can we all go get, like, as part of our annual executive health checkup, get a brain scan and know that, okay, you're going to get depressed next year?
Right. That would be nice. And research studies are trying to move in that direction. Psychiatry has a long history of simply characterizing what changes there are in psychiatric disorders. We still don't have a really good predictive test, or even, for instance, in diabetes, you could take a simple blood glucose test and know by what sugar level, and if it's with meals or after meals, or like a glucose challenge test, whether you may be prone to having diabetes. There unfortunately isn't so great a panel, if at all, for mental illness. What we can do is to screen for symptoms, and with increasing prevalence, simple self-report measures, something called the PHQ-9, for instance. It's a self-report depression inventory, set of just 9 questions, things that ask about your mood, about sleep, appetite, hopelessness, whether you might have thoughts about harming or killing yourself. So there's these questions that probe for key features of depression. And these are not just administered in psychiatric clinics, but increasingly even in primary care clinics. And really, that's a good thing, and I would advocate for even greater prevalence. Just like we take vital signs for physical health, blood pressure, respiration, temperature, and so forth, there really should be a mental health vital signs.
Right.
And so things like measuring your sleep patterns,
Yes,
exercise, probably even social connectedness. You spoke about loneliness, that actually can be a predictor for certain things, including psychosis, actually. So, I think...
yes, that...
Yeah.
So, it's interesting that you say that so much research has still not able... I mean, there's no real test that you can go and get a conclusive biometric test done and that says, yes, you're depressed. A lot of it is still subjective. A lot of it is still self-reported. And sometimes your physician just asking you those questions can be enough for us to predict. How do you think the treatment of depression has changed? Because I think there has been a lot of progress on that front.
Sure, yes.
And you personally have been involved in a lot of research on the treatment side, at least. And tell us more about, your latest research on TMS and how you're using it, and tell us more.
Yes, I'd be happy to. So I'll segue from the last topic, which is the predictive question. So while we don't yet have a test that will say this person will have depression, even if they appear sort of normal, what there has been great progress in is research into subtyping of depression. So if you, and there's been some really nice studies that have come out in the last few years, if you look at the brain functional connectivity patterns, either say through fMRI, functional magnetic resonance imaging, or there's comparable studies in EEG. You can use what's called machine learning methods to parse out what subtypes there are in a data-driven way, but then also see what might be predictive of treatment success. And to give an example, one of the fMRI studies looked at the subtyping of depression, and one of the groups had a response rate to transcranial magnetic stimulation, something I'll explain a little bit more about in a second. But that's a pretty remarkable finding, that I think it was something like 82% of people in that particular subgroup were responsive to TMS. So that's something that if it can become well validated and streamlined so that it can be easily disseminated and applied in the clinical setting, would be a sea change in psychiatry. There are certainly, cancer treatment is much further along in these sort of personalized approaches. But if we could get these approaches in sort of production mode and in so to speak, in regular clinics, a depressed patient would come in the clinic, we'd do a diagnostic interview, but then part and parcel of that evaluation would be sending for an EEG or an fMRI scan, doing this analysis, seeing what type there are, and the results should tell us, well, this patient may be good for TMS. Another subtype may be good for a certain type of medication.
Yes.
Another person might be more responsive to psychotherapy.
Right.
Another might be better for ECT. That's electroshock therapy, as it is popularly known, but electroconvulsive therapy. And this would be an extremely useful decision aid.
Yes, I think that would be a big breakthrough. And also, if you can, for our listeners here today, just elaborate a little on what are the different types of depression, because we all just mistake depression to be, melancholy or feeling sad, and or some people, now of course know bipolar depression a lot. And I think the categorization of depression also has changed over the years. So if you can just, in lay people's term, tell us the different types of depression.
Sure. Yeah. Well, you mentioned melancholic depression. There can be subtypes that might weigh more heavily in things like anhedonia. That's the inability to feel pleasure or as much pleasure as you might in things that you typically derive pleasure and joy from. There may be others that might suffer more from so-called neurovegetative symptoms. So disturbances in your appetite and sleep, the fundamental functions. You did mention bipolar and versus other types of depression. So what most people understand by sort of the standard definition of depression is major depression,
right?
Or and otherwise known as unipolar depression. So that means you have depression and depression only, and without any manic episodes or any psychotic symptoms, because there are disorders that where depression coexists with other types of symptoms. So if it's sort of just depression, major depression is what we label it as. Bipolar depression that you refer to has major depressive episodes, but also manic episodes. So it's kind of...
Can you give us examples of like patients of yours, what they present like? Because sometimes, we imagine it, we learn from movies, but realistically, if you could give us some case studies or just show us.
So one patient comes to mind, and I think his picture is fairly typical of a depression presentation. So he was a patient that I had when I was at the VA hospital here in Houston. He's in his 60s, and he'd had unremitting depression for decades. Tried antidepressant after antidepressant, and he had a whole host of symptoms. And I think I was mentioning that depression doesn't just include depressed mood, but things such as he experienced, such as something called anhedonia, which is the inability or diminished ability to experience pleasure. Insomnia and loss of appetite are also very common, and he had experienced those. Feelings of guilt, hopelessness, and in his case, it also included suicidal thoughts. And this can involve, unfortunately, a history of actual attempts. In his case, he didn't actually attempt, but he had seriously considered. We briefly mentioned TMS, and I was going to explain a little bit more about this. Fortunately, he came to our TMS clinic, opted for the treatment, and he really had a remarkable turnaround. And he, his mood obviously had improved. He started enjoying life and activities a lot more. Sleep and appetite improved. The suicidal thoughts all went away. And I'm comfortable sharing this because he actually wanted me to share his story as much as possible, and then gave me permission to do this. He came to my office one day before one of his final treatments and shared this tall, sort of somewhat wrinkly faced person who was rather gruff and irritable with me when I first met him. But during that interaction, he was, going between cracking a smile and having actually tears come from his eyes. In this case, tears of joy, because he was so elated at the turnaround that TMS was able to afford. He said that he was volunteering, helping out his brother in his business, answering the phones, and he noticed that he was enjoying those phone calls. People were giving him feedback that he sounded different. And he pointed at the TMS room saying, you have to get that to way more people. That can be a life changer. So
wow.
Yeah,
so what is TMS? I mean, this mystery treatment that we're all going to learn about today.
Right.
From what I understand, it's some sort of stimulation to the brain using magnets, but that's all I understand.
Sure,
Please, can you explain further?
Yeah, so TMS is a stimulation modality, one among many. Stands for transcranial magnetic stimulation. So transcranial just means it's going through the cranium, your skull, and it's done non-invasively. So what it essentially involves is a electrical coil that is placed on the scalp, and a electrical current is passed through the wiring, and that induces a magnetic field. And the magnetic field easily penetrates through the skull and stimulates the brain. The mechanisms of exactly how it might help depression and other psychiatric disorders, that's a field of active research. And we alluded to some of my own lab's research, and that is something that we've been awarded an NIH award to study the mechanisms of how TMS might work. One of the ideas is sort of modulating the excitability of our brain cortex. So in this study, what we're essentially going to do is to conduct a clinical trial of a form of TMS, and using EEG or electroencephalography together with TMS, going to probe the excitability of the brain. It's been found that in depression, the left frontal portion of our brains is hypoactive, meaning underactive. And one of the benefits of TMS is to restore that activity. And we think one of our hypotheses is that the excitability of the brain in that brain area may be compromised in depression, but is restored with successful treatment. And this could actually be not just with TMS, but with any antidepressant treatment. And that could be medications, psychotherapy, but in our case, TMS.
So how many sessions does a typical patient need?
So the standard protocol is 36 treatments. And initially, for the system that I use, it's a system called Brainsway, the company name. It's every day for 4 weeks. And by every day, I mean Monday through Friday. And then after that, it's twice a week for the remaining 2 months. A total of 36 treatments. So it is a time commitment.
Right.
But typically, when patients have failed a few medications, been frustrated by the lack of progress of their
Right.
treatment, they're more than ready to do whatever it takes
Right.
to get better efficacy out of their
Sure.
treatment. So the typical routine would be to come. The initial session takes a little bit longer, about an hour, because you have to locate where to stimulate and then how strongly to stimulate, and that's individualized for each person.
And the EEG helps you determine that.
Actually, the EEG we're just using in the research study.
Right.
In common clinical practice, we actually don't use EEG.
Okay.
There are very simple, effective ways of determining where to stimulate and how strong to stimulate. We can do that without any additional fancy tools. But we do that determination in the first session, and then we can use those values in all subsequent sessions. So first session is an hour. Every subsequent session is roughly half an hour, with the actual treatment being 20
Very
minutes.
interesting, because here at Sydenham Clinic, we're all about optimizing your health and helping you perform better. And I'm personally very interested in neuroplasticity, And I know there is research that shows that even though we're aging, our brains don't have to age. And I don't know, you can explain it more scientifically, but there's some neural pathways and you can build new pathways. And what are some of the different ways in which we can do that? And maybe we can even use this magnetic therapy for peak performance or enhancement, perhaps?
Yes, yeah. So that's a very exciting field. So these stimulation approaches, TMS included, but there's others. Something called transcranial direct current stimulation. Related to that, transcranial alternating current stimulation. These latter two are electrical stimulations of the brain, using a very mild current. But all these modalities have been explored both for clinical application, so treating things like depression or even bipolar and psychosis. But these are just tools, and these tools can be used in the neuropsychiatric domain, but also for cognitive enhancement,
Right.
even in normally functioning individuals. And TMS definitely does offer the possibility for a cognitive enhancement. There have been a number of research studies that have shown that with repeated administration, and sometimes even in a single session, can show measurable effects in cognitive ability. Either you can perform the same task faster or more accurately, or both. And it's pretty remarkable. I initially, years back, had great skepticism that
Right.
I thought it was too crude a tool. You're basically pinging the brain with this electromagnetic energy in a pretty non-specific way.
Right.
We can be fairly targeted, but even targeted in our case means at least a few millimeters, if not a few centimeters. Which in neural terms, that's very gross. Neurons, we're looking at microns. And
Right.
so this really non-specific stimulation, how could it help you do any task better? But lo and behold, there's many studies now that show evidence that repeated stimulations can enhance performance.
And there are other ways to stimulate the brain as well, right? I mean, this is just one method.
Yes, yeah. So TMS, TDCS, TACS, the ones that I mentioned. There are, even exercise.
Right.
So I don't want to keep just focusing on biological therapies. There
Yes.
certainly are lifestyle things like
Right.
exercise that have been shown to have neurotrophic effects. So induce growth of synapses and dendrites. Yes.
I mean, I come from India, so, we believe a lot in meditation and mantras, and recently, I've been researching how sound therapy and sound waves can help with stimulating different brain areas in the brain. And personally, I find it very powerful. I mean, this is just anecdotal. My personal experience is I think there are powerful mechanisms. Of course, I'm not severely depressed, so I'm looking for peak performance. That's my goal. Can you tell us a little bit more about neuroplasticity, the BDNF gene, and how to activate it? And
Sure, right. So BDNF is actually one of the key genes that have enhanced expression. You can measure differences with successful depression treatment, with TMS, with medication treatment, but also with exercise. So there seems to be many ways to skin a cat, so to speak.
Right.
But this is a very potent and common neurotrophic factor. Neurotrophic meaning inducing of growth of neurons. And then that mechanism actually seems to be both important for successful depression treatment,
right,
but also as you're referring to cognitive enhancement. There certainly opens up the possibility that you might be better at performing certain tasks the more proliferated your neural network is. I hesitate a little bit because you can't just do that non-specifically. You will highly likely need to then have some actual performance or training on top of that. So
for sure.
If you marry, say, TMS or the other stimulation modalities or exercise, anything that might induce BDNF
right.
Based neurotrophic processes, it's likely that you'll need additional training, whatever it might be. You're trying to
skill
or new knowledge. It's highly likely that you're going to need additional training. So you can kind of think of it as maybe hardware, software.
Right.
You can help to support the software and build it up using things like stimulation or medications or even exercise. But then you need sort of software changes, and that can happen through the training.
Right. Which brings me to my next question, and we discussed this very briefly earlier today, that you have a passion for this controversy, if I may say so. Or I mean, that's, it's your academic interest, I guess, is the whole, like we have the nature-nurture controversy. There's about the free will and determinism.
Right.
And I've always believed that health is by choice, and, we have the freedom to make better choices. And is mental health a choice? And what is your view on this?
Sure, right. So, I mean, we're all psychological beings, of course, and with a sort of subjective awareness. And we certainly all feel like we have free will and make decisions for ourselves. And no matter what your views are on this topic, I think the way most or all of us live our lives is sort of implicitly assuming that there is free will. And related to that is the decision-making process. So, I think being aware of monitoring your own health, factors that might impact your health, is an important step. But then, as you note, taking that step forward and deciding in a positive way things that might support your wellness and well-being. Where determinism, I think, comes in is in trying to understand the underlying mechanisms of well-being and mental health. And I guess for those that might not be familiar with this term, determinism, it basically outlines the idea that if you are able to characterize with great precision all the factors that are currently existing, and then you have an accurate model about how those factors may interact
Right.
to then predict the next point in time.
So there is a cause.
Yeah, so for every effect, there's a cause or sets of causes. So if you had a perfect model of the universe and you knew where every single atom and molecule existed and where they were moving to, then you could predict all future states
Right.
by this notion. Where that comes into play in the field of medicine and psychiatry included is we spend, as society, as researchers, as doctors, lots and lots of time and resources in trying to understand the mechanisms of illness and including in mental illness. So the whole project of medical research and medical practice, although it might not always be conceived in this way, it takes that deterministic framework. How best can we measure what's going on at any given point, and then understand the system well enough so that once we understand where things stand, how best can you predict how things will unfold? So to give a concrete example, you mentioned, is there a test for depression? And could you predict whether a person who might otherwise appear stable in the future develop depression? So one could imagine, whatever set of genes, for instance, or if you take a brain imaging test and notice a certain pattern of activity, you might be able to combine those results with the genes and maybe some cognitive testing and family history, put that all together, and if you have an accurate model about how things will unfold, predict that, this set of patients or people may develop depression and these set of people may be resilient and not develop depression.
Right.
Importantly, if you have that accurate understanding, you can also then ask questions, how do we perturb the trajectory,
Right.
So that they don't develop depression? And that comes down to understanding the mechanisms of how people develop that depression and developing therapies then that will change the course of that disease.
So you obviously feel that this is a better approach and it is a more conclusive approach to science.
Yeah, well, I think it may be just determinism. I think is probably the only game in town for science. I do want to acknowledge, as I was trying to do in the beginning, the psychological reality of how we think and behave. I believe that when I lift this glass up, I'm the one that decided exactly that I should lift the glass up, that I would do it at that particular moment. And my subjective experience of doing that is one of having free will to do that.
Right.
What I'm about to say to you in the next second, likewise. It's kind of an interesting conundrum that, if you believe in a deterministic universe, that within that deterministic universe there exists this subjective experience of free will, and our culture and social interactions all are predicated on what we assume free will existing. Otherwise, for instance, in the criminal justice system, no one would be responsible for anything that they did.
True.
You could steal something, murder someone, commit fraud, and it's not really your fault because it's all explainable by prior causes. So that clearly can't fly.
Yes.
But I think just as what happens in the field of medicine and psychiatry, our whole project is to try to understand all disease phenomena as best as possible, to be able to educate ourselves, patients, families about how diseases may unfold, and then ideally how to modify the course so that they don't end up suffering from the bad outcomes of those diseases. And this kind of going on a tangent, but for instance, in the criminal justice system, similar things might be possible if we have a complete understanding of what leads to criminal behavior.
Right.
in essence, that could be something like understood as a disease.
Right.
And we can come up with ways to prevent people from engaging in those behaviors.
Interesting.
Yeah, so.
Well, thank you so much for sharing all this information. And I think if we can help even one person or two people or five people step up and recognize their own mental health, whether they want to improve it or whether they want to get a diagnosis, I think there are tools out there that can help them, and there is hope, more importantly. But before we end today's podcast, I always ask each guest what their secret sutra is. And since our topic here is mental health, I want to know, and I said sutras means rules in Sanskrit. What is your secret sutra for your mental health? Because I'm sure you're human, you have stresses, you're like all of us, but how do you keep yourself mentally healthy?
That's a good question. I probably have difficulty just choosing one, but a few things come to mind. This is tried and true exercise. So I can't say I do it every day.
So you exercise a few times a week? Or?
At least a few times a week.
And what's your favorite exercise?
My go-to is running. It's not the most exciting, but it's easy. It's flexible. You don't need much, equipment, and you can just do it anywhere, anytime. But very reliably, it helps improve my sleep, my mood, just overall sense of well-being. I mean, it's. Anybody that's exercised with any regularity,
yes.
I'm preaching to the choir. I think that's been critical. The two other things that come to mind, one is family, and I think actually just to circle back to our contextualizing this in the COVID period, there's obviously been lots and lots of tragedy and hardship during this time.
Yes.
But I think what many families hopefully have experienced also is being drawn closer together. And in particular with my kids, I've actually had a lot more time to spend with them. And I think it's been one of the most gratifying sort of human relation experiences that I've had in quite some time. There's been lots of challenges and issues that I myself have had to deal with, but having that increased interaction and strengthened bond, and that's just been very gratifying, and it helps to weather all the other craziness and issues. The last thing which you already mentioned is music. Yeah, I think that's literally been a lifesaver in many respects. Been passionate about music for probably the last 4 decades. Grew up playing classical piano, and more recently got into more pop rock music and jazz. I think the intellectual engagement, the emotional sort of space that you can explore with music, it's just so immensely gratifying. I mean, just even as a listener, almost everybody has
for sure
the kind of music that they like to listen to, and gets them through difficult times, or allows them to experience different emotions, joy, sadness, anger in different ways, and ways in which that simply language or poetry or novels just they have their role too, their place. But there's ways that music can do that nothing that it can do that other modalities can't approach. So music has had that sort of special place in my heart and in my life. I'd say in many ways it's almost literally been a lifesaver. So I don't know if I would conceive of it as a set of sutras, but I think, those are the three big things that come to mind.
Thank you. That's wonderful. So music, love, and exercise.
Yes.
Thank you. That's powerful. And thank you for sharing, all your secrets with us. But these are simple secrets. And I think these are things that we can all do, even in this COVID environment. As he said, exercise is really good for increasing BDNF. Music is a powerful tool, and these are things that you can do alone. And more connection with loved ones. I know physically it may not be possible for us to connect, but just for us, our families also, come closer because we're doing a lot more Zoom calls, we're doing a lot more FaceTime, and I think that connectedness is more important today than ever before. With that, I will end today's podcast. Thank you so much for tuning in, and thank you so much for taking time out. I know this was very difficult for you, but I really appreciate it. Thank you very, very much.
Yeah, thanks very much. I enjoyed it very much. Thanks.
All right. Thank you.
Thanks.